The U.S. Department of Health and Human Services has announced significant changes to the federal recommendations for childhood vaccines. Let's talk about what that means. Back in December, the president issued a memo directing HHS and the CDC to align the U.S. federal vaccine schedule with those of 20 peer-developed nations. As a result, HHS has changed its recommendations for hepatitis A and B, meningococcal disease, rotavirus, and the flu.
Where before the schedule said every child should be vaccinated, that was the recommendation. Now it says that every family should have the opportunity to choose vaccination after a discussion with their healthcare provider. And officially, that's not considered a full recommendation.
That's Dr. Josh Sharfstein, who is a pediatrician and former health official. He joins the Public Health on Call podcast this week to talk about the announcement, its immediate impacts, and how it can reshape vaccination in the U.S. He explains that this announcement has made clear that families will still be able to access these vaccines even though they are no longer officially recommended. Distributors like the Vaccines for Children program and private insurance will still offer and cover vaccines.
But there's a concern that these vaccines that are no longer fully recommended may fall off the school vaccine requirements in some states, because it's a signal that these just aren't as important as vaccines. If some states change that and then parents get the message you really don't need to vaccinate against these conditions, you could definitely see a resurgence of illness affecting children in these areas. And these are some pretty significant diseases.
Dr. Sharfstein also talks with fellow pediatrician and global vaccine expert Ruth Karen about how serious resurgences of these infections can be, highlighting the long-term impacts of this week's decision.
The notion that a child or their family would suffer unnecessarily from a disease that we can prevent it's really very upsetting.
You can tune in to Public Health on Call to understand why and how these vaccines have been so effective at safeguarding health and preventing illness, and what might happen now with these new changes.